Okay, so I am really excited to put out this podcast this week. Thanks for joining us again on Spine and Body Podcast. But this is the week that the book comes out, and this is the week that I kind of explain this body guitar theory that is the next step, right? Kind of this next understanding. So I want to go briefly over what we went over last time, and explaining things differently. Just a little bit helps us to understand. So, in the way the spine is stabilized, the way we see it through body guitars is that in the back of the spine, the muscles that run along the back of the spine are high tone muscles that pull the facets and pull the vertebrae posteriorly together. And when I say high tone, these are muscles that are constantly contracted. Right? And the only way they are not contracted is when there's pain, either from a facet joint or from a disc bulge, that whereby pulling the back into itself posteriorly causes more pain. So then these muscles, specifically the multifidus, but also the spina recta muscles, these muscles are shut down by that pain, right? They're also shut down when they're stretched. Okay, so when are they stretched? Well, when we lean over a shopping cart or lean over a counter, right? When we have bad posture, these posterior, what we call bracing muscles, lose their tone or are inhibited, just like they are with pain. The other way is that when the string muscles are tight, overly tight, right? So do remember, one of the things I said last time is that the muscles that we call bracing muscles are the ones more in the back, and then the string muscles, so the bracing muscles are small segment, high tone muscles that pull the vertebrae together, and then the string muscles really are, in the case of the lumbar spine, are hip flexors, right? So psoas, iliacus, quadratus lumborum, and they are large segment stabilizers, and they are more your typical pull muscles where they contract and pull. And what happens is they go all the way from the diaphragm to the hip, and they stabilize us more in the front. It's on either side of the spine, but more in the front. So what we have is we have small segment postural muscles that when we're relaxed, they're contracted. And then we have large segment postural muscles that pull on the front side, which together creates a stability. So you think about it like the wood of the guitar and the strings of the guitar. And that's the body guitar theory that I described last time. Now, realize that what has been proposed over time has really been a biomechanical model until recently. And when I say biomechanical model, what I mean is that it's an understanding of stability. So Vladimir Janda laid out the steps as far as stability went, as far as bony stability, muscular stability, ligament, and then he started having other theories which he called upper cross and lower cross syndrome, which was really about what groups of muscles together tighten, etc. And then Dr. Stuart McGill advanced that even further by talking about the guy wire system, which is where he talked about how core muscles are like guy wires on a radio tower. And each of these added to everything that we knew and has significantly elevated the rehab world and our understanding of back pain. But what it didn't do was finish kind of the understanding of how things work. And that's was taken on then by this this biopsychosocial model. And the biopsychosocial model basically says your level of stress leads to increased pain, and only by controlling the stress are we able to control your pain. Well, the two sides didn't really meet. We had one group saying, no, this is biomechanical, and the other side saying this is biopsychosocial, and both have somewhat had their issues, right? We know that the biomechanical works because it's what people have used for years, but it doesn't work completely. And then we know that the biopsychosocial works because because when we decrease people's stress, they do improve, right? It's just a matter of how much. There was a recent study with rheumatoid arthritis where they have used vagal nerve stimulators and had quite a bit of improvement, and quite significant improvement, and decreasing inflammation. So we know that by decreasing inflammation, we're able to improve, pain, and by affecting this vagal nerve, which is boosting the parasympathetic system, we know that we've been able to affect that inflammation. So we know that there's a tie-in there. Well, what makes pain management hard, or low back pain? How about this? What makes low back pain hard is that when a person gets low back pain, they develop patterns of motion and changes in the way that they stabilize themselves that create long-term issues. People will say all the time, they'll say, I injured my back, and even though I got, back to normal activity, it's like something changed. I slowly got worse and worse and worse, and ended up with chronic back pain, even with my best efforts. Or somebody gets a terrible bout of back pain, which really weakens them, and they never get back to where they were. So the body guitar theory tries to explain both of these. And so what I'll try to do is try to take us through step by step and see where we get. But do realize that if we're talking about bracing muscles that are strongest in contraction, or excuse me, are strongest, have highest contraction when we're relaxed, and I call these the wood of the guitar, we are firing these muscles most completely when we're in a parasympathetic state. Okay? And then when we talk about the string muscles, and the string muscles are pull muscles, and we start to realize that throughout the body, everywhere you see string muscles, each of these are contracted when sprinting, right? So if I'm going to sprint, I draw my stomach in, I chest breathe, I lock my head in place so that my head doesn't bob all over the place. I use quadratus lumborum and hamstring rather than glute muscles to pull my hips up and down faster. My feet contract. Each of these things becomes, how do I streamline my motion by tightening these muscles and creating faster motion? And that fits right into what we talk about with fight or flight. So if you look at each of these muscles and say, these are our sprint muscles that we also happen to fire when we're in pain or stressed, these are our fight or flight muscles. So we can actually start to classify muscles as parasympathetic and sympathetic. Okay? That's where we start transitioning from I'm in pain to I'm having a fight or flight response, okay, to chronic back pain, right? So the step that we get to where we start talking about chronic back pain is that each of these muscles are what we would call endurance muscles, right? So there's two basic types of muscles. One is a ballistic muscle that is powerful and stores its own, it creates its own storage units of energy. That's how the muscles are getting bigger. They have their own storage units of energy. And then a ballistic and a powerful component to that. And then you have endurance muscles. And endurance muscles build their own blood flow. And then they're able to trickle energy constantly, okay? The thing about bracing muscles or any postural muscles, they can never be big. They can only be endurance, right? Because we're using them to stabilize ourselves. The problem with that is that a ballistic muscle that you quit using will take a while to lose its strength, and then to build strength back up takes 6 weeks. An endurance muscle takes a long time to build blood flow. Some people even suggest 6 months to build blood flow. And they will lose strength rapidly. Within a few weeks of not using an endurance muscle, they'll lose the small muscles, the small vessels that are trickling energy to them. And then to build that back up takes 6 months. So imagine if I have pain and my bracing muscles, my multifidus and spina erecta muscles, are inhibited, and I start overusing my sympathetic postural muscles, which is hip flexors, really in the case of the back, it is not long before, even if I am out of pain, I can't fire those multifidus. And what happens is I'm forced to use my string muscles, psoas, iliacus, quadratus lumborum, for everything to stabilize myself. And one of the ways we see this is that people who have a normal healthy back, most of the time they're pulling equally between the bracing muscles and the string muscles. And they'll have probably 10% of the time they're sprinting, maybe 5% of the time. They'll have 5 to 10% of the time that they're relaxed and they're using just the bracing muscles, right? But a majority of the time they're in balance between both. They get in pain, these posterior muscles or the bracing muscles are inhibited. They become string muscle dominant. Hip flexors get really tight. But previously they'd be able to bend down and pick up something using the string muscles to pull them. And then they'd be able to get back up using the bracing muscles to stabilize them, and everything be fine. But what happens is after they've had back pain for a while, the bracing muscles are weak, the string muscles have taken over, they go down to pick up something. Now the only way they can get back up is they create tremendous intra-abdominal pressure by holding their breath. And that allows the period of time where they can lengthen these hip flexors or string muscles and not use the bracing muscles at all, right? So all of a sudden, this intra-abdominal pressure creates the stability that is necessary to maintain, to get through their day, especially when they need to lengthen those string muscles, where they wouldn't be stable at all if they didn't breath hold, because they don't have the good pull from the posterior muscles. So the next thing that happens is that these string muscles, I remember I said they go all the way from the diaphragm down to the hip. Well, they inhibit the gluteus muscles. And one of the things that we see, and I said this earlier, when people sprint, instead of using glute muscles exclusively to pull our hips up to give our legs room to swing, when we sprint, we have one of the string muscles is called the quadratus lumborum, and it pulls the hip up hard as the opposite hamstring pulls it down hard. And we'll see this where instead of using the gluteus muscles to stabilize us, now all of a sudden the hip flexors are pulling the hip into the hip socket. The quadratus lumborum and hamstring are doing most of the work of moving of the pelvis. So then your gluteus muscles atrophy. They're actually inhibited by the pull of the hip flexors, or as we would say, the string muscles. So you have inhibition of the gluteus muscles because you're overusing these string muscles because you've lost strength in your bracing muscles. And it's leading to us breath holding all the time, hamstrings over tight, hip flexors over tight, or string muscles over tight, which of course affects us chest breathing, which makes our neck tighter, right? There's just all these downstream findings that we're finding when a person has pain, one causing another, right? So a person gets out of pain, they start trying to work out again, they fatigue their gluteus muscles, which they've not been using, and instinctively, without even a thought, they don't say to themselves, oh, my gluteus muscles have fatigued, now I need to use my hip flexors. They just start using the hip flexors, which causes them to chest breathe because they can't, because their diaphragm gets locked, which inhibits the contraction of these string muscles, inhibits their bracing muscles of the back. So here we are, out of pain, no longer in pain, and because our gluteus muscle has fatigued and because our bracing muscles are weak, we go right back into the same situation, same muscle contraction pattern that we would have if we were hurt. And then we're locked there and we never can get out. Not only that, but because we're using all of these sympathetic muscles, and we're overusing our sympathetic muscles, we have increased inflammation. We have increased fight or flight, so we have more opportunity for other things to be affected by this high sympathetic tone. which of course increases inflammation in the discs. As we've talked about, it increases inflammation in the joints, and a person is stuck in this mode where they have trouble getting out forever. So there has to be an approach where we say, listen, step one is I have to get you out of pain. Step two, I have to take the strings off the guitar, right? Figuratively take the strings off the guitar, which means if I'm going to repair a guitar, the first thing, if the wood is broken down on a guitar, the first thing I do is take the strings off, because I can't fix the wood when those strings are on too tight. So if I'm going to strengthen a person's glutes and bracing muscles, I have to take the strings off the guitar, which means I have to learn how to decrease my sympathetic tone. I have to learn how to abdominal breathe and get my hip flexors out of it, right? So I've taken the strings off the guitar both by decreasing my sympathetic tone and decreasing my string muscle tightness. And only at that point can I start strengthening the glutes back again. And when I talk about glutes, I'm talking about external rotators, glute med, glute min, right? So very specifically, I have to work on those muscles, and then I have to work on this multifidus spina erecta muscle. And understanding that each of these plays a part, right? And I also have to work on posture because posture is the other part that inhibits my multifidus. Okay, so the goal becomes I have to decrease pain. I have to take the strings. I have to stop using my string muscles so much, at least during physical therapy. And then I have to decrease my sympathetic tone. And that brings this biopsychosocial and biomechanical model together so that we can understand how the spine is working, right? And how to get us out of this trap where we're constantly flowing right back into weakness. And I can't tell you the number of people that we see who we'll see back 2 years later after treating their back pain, and their glute is still weak because they never quite understood how to get things firing correctly. And every time they're active, their glute will fatigue and they'll go right spiraling right back into this problem that they had before. Or we'll see them back and they'll say, no, I got back to working out, and we get an MRI and all of their multifidus muscles are fibrotic, right? They're not using the muscles correctly. And because they're not using the muscles correctly, I know that one little thing happens and they're right back into low back pain. So I hope this makes sense. The book is coming out this week that is explaining this body guitar theory. And I think that it brings a lot of things together. I'm really excited that it brings a lot of things together. So the first week, before November 10th, we're trying to get this podcast out as quick as I can. So if I rushed through things, it's because I'm trying to create this podcast so that it can be out before the book is released. And the reason is because before November 10th, so November 9th at midnight, the price changes, but our Kindle version is $2.99, right? And then that changes November 10th. This book is all about what I've just been describing. I think that it's a fundamental change in the way that we look at back pain. I've already started work on the neck and shoulder one, so I've been asked that 100 times. Because this is a change, right? This idea that we do have sympathetic and parasympathetic muscles. Cortisol affects this. And everything else that affects cortisol also affects this. So it's a bringing together of biomechanical and biopsychosocial models. And I'm super excited to introduce this to the world. And I'd love some feedback. But the book is called UPRISE, Body Guitar Theory and Back Pain Liberation. It's on Amazon exclusively right now, and I can't wait to share it with you. So thank you.